to do. You look at some of the other things that we can do. Now, the mantra, one of the things that we teach here at LVI is to be absolutely as conservative as you can be. There's no reason to take out tooth structure that doesn't need to come out. Some of the most aesthetic approaches that we have in dentistry today happen to also be the most conservative. And so we have the opportunity to restore teeth and bond directly to the tooth structure with bond strengths that approach the levels of the bond between the different layers of the tooth. We have the ability to fix our patients' smiles aesthetically and functionally and extremely conservatively. And that's where we're going to start. That's where we're going to design every case. Now, if the patient wants to have an aesthetic change, and maybe if they need to move a midline over or something like that, it will be a little bit more aggressive. The golden proportion is out of balance. We may need to change that. So we may need to be a little bit more aggressive in some of those cases. But we can accomplish what the patient needs and be as conservative as possible and end up with something that's incredibly beautiful, long-lasting, functional, and supports physiologic health. And that's really where we want to go in these cases. And you look at some of the examples of changing a patient's lives, the quality of their life, how they feel about themselves just by changing the aesthetics of their teeth. You take something like a diastema, that if you're plagued with a diastema, some people, David Letterman, gets along just fine with it. He loves his diastema. My grandfather has a diastema. I'm not opposed to diastemas, but the difference that it can make in the aesthetics of a patient's smile can be huge. If you got a patient like this that has a diastema, you know, this is a decent looking guy. He looks like he's a pretty competent person, but the difference between what he looks like with the diastema fixed and what it looked like before is huge. And it can be fixed extremely well. You can create proper balance, proper proportion in his teeth, and you can dramatically change what he looks like, who he is, by changing that diastema. It's powerful, and it's easy. You just have to understand basic concepts of aesthetic dentistry. Correcting the golden proportions. Now, this is kind of a cool case where the bruxism was actually stopped. Remember, we don't know what causes it. We don't know how to fix it. Some people are stuck with it, and you can't do anything about it. It's not true. Unless it's induced by some kind of medication, you can stop, literally, you can stop bruxism in every one of your patients, unless it's caused by something else. That something else is almost always medicine. If they're on a medication that creates grinding or bruxism as a side effect, you can talk to their physicians about changing it. Otherwise, it's going to be a muscle issue. The muscle's trying to find a more comfortable place for that patient to go. Or there's a collapse in the inner ear. You've got, not in the inner ear, but in the tensor veli palatini, a little muscle in and around the ear, and that muscle is cramped and you're trying to actually scratch it, open up and create balance in the eustachian tubes like when you're on a plane. Those are some of the issues that are going to be creating the bruxism in patients. But if you get the proper neuromuscular balance to their bite, you can stop the bruxism. You can help that patient to create a macroocclusion that supports comfortable muscles. Comfortable muscles don't grind. It's that simple, that straightforward. In this case, great looking all-American kid. He's got some teeth that just didn't really quite fit like they should. Physiologically, he's paying a little bit of a price for it. Not that it's necessarily unaesthetic. He would get along just fine with teeth like that. But when you look at the difference, it's huge. Aesthetically, looks way better. But what it also did was it fixed the bruxism. It fixed the grinding problem because you created the proper physiologic balance to the bite. Patient's got no reason to grind the bite away anymore. When you take a look at the difference before and after, it's giant. Great looking all-American kid, greater looking all-American kid. But more importantly, we fixed the bruxism. We stopped that wear and tear on his teeth when he's young, not waited until he was in his 40s or 50s. And this is a case, really, really interesting case. This was done as sort of a ticket to heaven case. There's a dentist in Tulsa, Oklahoma, Dr. Kevin Winters, who had this patient that came in who hated everything about her smile. And this is interesting how it changes patients' perspectives on who they are. She had been going to school with teeth like this, and of course she's got no reason to want to keep teeth like this, so she didn't brush teeth like this. When they came in and took a look at what was going on inside, they had to kind of hose off all of the buildup on the teeth so they could get a look at how bad the decay was underneath. She was an extremely introverted person. She wouldn't smile, wouldn't talk. It was all they could do to even get the smile photos beforehand. She was trapped behind her teeth. Just like Mackenzie, just like Jamie that we saw earlier, she was trapped behind teeth that she didn't like. And what you end up doing is you clean them out, you get rid of the decay, you find out that the nerve's been dead for a long time, you do your endo, you do the buildups, and you get that patient into a place where you can actually functionally restore those teeth. Provisionalize it, make sure that you've got teeth that will work for the patient, and long term, rebuild them in porcelain. The great thing about it is she felt like that for a long time afterwards. I don't know how many of you have made dramatic life changes in how you look or how you feel, but for a long time after you make a big change, whether it's you cut your hair from short to long or you grow it from long to short, typically if you cut it from short to long, it's such a fast thing that you don't remember that you did that. So you have dreams about yourself still with long hair. If you've got a patient like this that comes in your practice and they're still dreaming about themselves, having these ugly teeth, having the decay, having the problems, hating their teeth, hating their life, if they still feel about themselves, even after you've restored them, they still feel like they're not worthwhile enough, they're going to live their life like that. It takes a while to get to the point where you can re-identify yourself with who you are after. In her case, it wasn't in the provisionals that she had that eureka. It wasn't in the porcelain that she had that eureka. It wasn't until they brought her back in and they started taking the after photos, after she'd been in her new teeth now for maybe a couple months, that she finally identified herself with someone who had a beautiful smile. And she has an absolutely radiant smile. And it brought out this absolutely radiant personality. Didn't exist beforehand. She was introverted. She was quiet. She was always withdrawn. But when she started to realize that she was this really cool person inside, it was giant. Those teeth made the difference in her life. As a high school kid, junior, senior in high school, first year out of high school, kid in college, what kind of a path is it going to put you on? If you can wear teeth like this instead of the teeth that she started with, it's huge. The difference that Dr. Winters created in her life is something that you cannot possibly fathom until you've been a part of it. That's what changing lives is about. That's what quality dentistry can do, and it's all about comprehensive diagnosis. It's not about making sure that you use the right material even. It's about making sure you use the right diagnostic approach. You help your patients to make a decision that's right for them, and you offer them the opportunity to fix what can be fixed. You offer them the opportunity to help them to get into a physiologically correct position, and the sky's the limit. Some amazing things can happen.